I'd like to introduce you to Mr. Thomas, a hypothetical yet very real elderly farmer who came to the clinic. With weathered hands and a quiet voice, he's the type of patient who shows up on time, listens carefully, and never complains. Like many patients, Mr. Thomas takes several medications, one of them being an anticoagulant, something he'd been on for years. One day, I asked him a simple question. Mr. Thomas, do you know what this medication is for? He looked down at the bottle, pointed gently, and said almost apologetically, well, I know this one's for my heart, but I don't really know why. I just take it because they tell me to. Mr. Thomas didn't understand the word anticoagulant. He didn't realize it made his blood thinner, and he certainly didn't know that getting a deep cut while working on his farm, something he'd done his entire life, could turn a normal workday into a medical emergency. Mr. Thomas wasn't careless. He wasn't non-compliant, and he wasn't ignoring medical advice. He was doing his best to follow the plan, but the plan he was given may as well have been written in hieroglyphics. He didn't need another prescription. What he needed was a translator. And while Mr. Thomas may be a hypothetical patient, the confusion that he represents certainly is not. As a medical student with a master's in public health, I've watched something deeply troubling happen again and again. The very information meant to help people is delivered in complex conversations filled with medical jargon that most patients simply don't understand. And that is the reality millions of people face every day, navigating healthcare in a language that isn't theirs. Every month, more than 70 million people visit WebMD hoping to understand their health or that of someone they love. And nearly 9 out of 10 adults in the United States struggle to understand health information. For the millions of people with limited health literacy, what they find isn't only confusing, it's debilitating. And here's the uncomfortable truth. Understanding is rarely built into our healthcare system. Sure, we have electronic health records. Yes, we have patient portals. And of course, we have discharge instructions and glossy brochures. But electronic health records store information. Patient portals display information. And leaflets, well, they list information, but none of them translate it. So patients sit in exam rooms, nod politely, leave overwhelmed, and later realize just how little they actually understood. To the average patient, medical language becomes a barrier to achieving the best possible outcomes. Whether it's Mr. Thomas in Appalachia or a high-powered CEO in Chicago, this moment feels all too familiar. If you're comfortable, please raise your hand if you've ever sat in a doctor's office thinking, I have no idea what they just said. Yes, right? You can put your hands down, thank you. You see, that frustration comes down to one simple gap: the difference between being told something and actually understanding it. Because whether it's a parent, a neighbor, a partner, or a friend, that gap doesn't just cause frustration. It can lead to actual harm. Because when even one patient doesn't understand their diagnosis or treatment plan, the consequences don't end at that visit. They can follow them for a lifetime. But it doesn't have to be this way. Imagine this instead. You're sitting in a waiting room, flipping through a 3-year-old copy of Nature's Homes magazine. To your right, the front desk are answering ringing phones and moving along a busy check-in line. In front of you, a television plays an ad for the latest medication, complete with a smiling family, a bounding golden retriever, and a list of side effects delivered at lightning speed. But to your left, something is different. There are a few self-serve kiosks, and above them, a sign that reads, "Your Health Simplified." You walk over and tap the screen. A familiar health intake form appears, nothing new here, and you breeze through it. Then something unexpected pops up, your health understanding. You pause, you answer 6 short questions, and that's it. The display changes, reading, "Building your AI health summary." A moment passes, and then suddenly, a personalized explanation of your health appears for you, written in your language. For Mr. Thomas, it might say something like, Mr. Thomas, this medication makes your blood thinner so dangerous blockages don't form and stop blood flow. If you're injured, seek help right away, as it may be difficult to stop the bleeding. Same medicine, same science, different language, better care. And this isn't hypothetical, it's evidence-based. Research has found health literacy to be one of the strongest predictors of health outcomes, more powerful than age, income, and even education. And according to the CDC, improving health literacy could prevent nearly 1 million hospital visits and save over $25 billion a year. And these aren't abstract numbers. That's 1 million patients like Mr. Thomas leaving the hospital with discharge instructions they can't decode and later returning through the emergency room doors. Together, we can build a different type of healthcare system, one where appointments feel like conversations, not lectures, where providers feel more efficient, not burned out, and where patients feel empowered, not overwhelmed. Seeing this need for a true difference maker led me to co-create what I call the Digital Health Translator. It's an AI-powered patient education platform that takes complex medical diagnoses, treatments, and transforms them into plain language summaries written at each patient's reading level. It uses research from the newest vital sign health literacy test, and it even generates the questions patients want to ask, but don't always know how to phrase in the moment. It can act as a journal, log side effects, and identify medication interactions. And most importantly, the information it provides is grounded exclusively in academic research and peer-reviewed journals. This matters because unlike many AI tools today, this ensures that patients don't receive information that is made up, oversimplified, or misleading, but is instead accurate, responsible, and trustworthy. It even passes what I like to call the kitchen table test, because the most confusing part of healthcare doesn't always happen in the exam room. Oftentimes, it happens afterwards, at home, staring at 30 pages worth of discharge instructions, just trying to remember what the doctor said in those 15 short minutes. But what about the grandparent who lives miles from the nearest clinic? The teenager who can't drive yet? Or the caregiver just trying to keep track of it all? They deserve clarity too. And instead of scouring the internet trying to piece together what everything might mean, they can get clear answers in plain language right there at the kitchen table. Because healthcare shouldn't only make sense in the exam room, it should make sense at home too. This year, we're preparing to launch our digital health translator across multiple Appalachian hospital systems with the goal of scaling it publicly nationwide, ultimately moving this tool out of the clinic and into your pocket. But before this tool is everywhere, and digital health translators are built into our healthcare system, there are some things you can do now. And it starts with one simple question. The next time you're handed a prescription or a test result, ask, what is this for? Not because you're challenging your doctor, but because understanding your own health should never feel like overstepping. And when they explain it to you, try repeating it back in your own words. The moment you can say it out loud is the moment you own it. You can also prepare 2 or 3 questions before each appointment. Not everything, just the things that matter most to you. And when you do look things up, choose sources meant to inform, not frighten or confuse. Places grounded in science, not sensationalism, and written at a level meant to be understood by all. But most importantly, you must be honest about confusion. Because confusion isn't non-compliance, and it's not a failure. It's certainly not a lack of intelligence. It's a sign that the system didn't translate. And that's why this work matters. Because understanding your health should never feel like a bonus feature. It's not something you earn by education, income, or zip code. Understanding your health is a right. And when we give patients the language to understand their care, we're not just inspiring independence, we're restoring dignity. I'll leave you with this. Several years ago, I lost a dear friend to a medical complication that went undiagnosed for months. the kind where appointments come and go, but the clarity never comes. I think about her often, and I still wonder if a tool like this might have changed her outcome. Maybe it wouldn't have changed anything, but maybe it could have changed enough. The truth is, no one can say that with certainty. But here's what I do know. She wanted to understand, and she deserved to understand. What does access to healthcare mean if people can't understand the care they're being given? We may not be able to fix every broken part of our healthcare system overnight, but we can fix the silence. We can fix the confusion. Mr. Thomas already knew how to take care of himself. He'd been doing it his entire life, in fields, in seasons, in a language passed down through generations. What he needed was for medicine to speak his language. And when it does, for the millions like Mr. Thomas, we can finally give people their voices back. We can finally translate care into compassion. Understanding must follow patients home. Regardless of whether the language is English, Spanish, or medicalese, when we finally start speaking the same language, the future of healthcare won't just be profound, it will be human, and it will be so worth it. Thank you.